The FLOA protocol is the most powerful solution for lasting weight loss. There is no other protocol that combines the strategic approach towards fasting alongside other lifestyle interventions that give us the calorie deficit that we need, but also improve our hormones for lasting weight loss. Utilizing any other method is only going to drag the process out and make it that much longer for you to hit that goal that you've been waiting for. Hi, my name is Dr. Jones, and I'm a holistic obesity expert. I've helped thousands of patients achieve lasting weight loss. A little bit about me as far as my background. I struggled after I lost 100 pounds to maintain my weight loss. After 10 years of trial and error, I figured it out. And then in the last 10 years of clinical practice, I've helped thousands of patients do the same, both with and without those powerful GLP-1 medications. Now, you might be thinking, long fasting, that's so difficult for me. I get it, and I agree, but we make the program easy to slip into long rounds of fasting, both with powerful GLP-1 medications like semaglutide or tirzepatide, powerful fat mobilizing agents, and so much more science-backed options. In this video, I answer key questions from my private group regarding implementation of this protocol, powerful peptides. Enjoy, guys, and we'll see you at the next training. In this program, the way it's designed is if you follow the protocol, you will very much less likely hit a plateau. Now, with that being said, the most common mistake with this program is you get into a rhythm, you're fasting for 48 hours, but then the tirzepatide is so freaking powerful, right? Or semaglutide if you're using that even though you remember that I told you, because I made you count your calories for a couple weeks, and you know what let's just say your TEE is 2,000 calories. You did count your calories for 3 weeks, so you remember what 2,000 looks like, but you just kind of let life get in front of you, and you just let yourself undereat. That is, if you guys want to know what is the number one thing to look for in my program, once you have everything down, what is the thing to be thinking of? That's the most common pitfall that people run into. It's literally what I just said. People let themselves undereat, and it's because tirzepatide is so freaking powerful that it happens, right? So you have to be cognizant, you have to be conscious. That's why I make you count your calories for 3 or 4 weeks, so you remember what a full day's worth of food looks like, and you estimate. And even I would rather you overestimate on those other 5 days, because you're going to be fasting so much that you're going to get most of your weight loss in that phase. Now, you absolutely do not need to fast 48 hours every week because you're at your weight loss goal already. The biggest difference, guys, between FLOA protocol and FLOA lifestyle is decreasing the frequency of your long fast. So really let that sink in for the people watching this that are already at their goal. The big difference, once you're off the med and you're stable, because you guys have seen my videos on weaning off, you decrease the medication slowly and surely. You keep fasting 48 hours every single week. Once you've had about 2 weeks where you're off the meds, weight stable, then you start to wean off the fasting. You decrease the frequency. Once you're fully stable, I still want you, the FLOA lifestyle still calls for a 48-hour fast once every 2 to 4 weeks. And that is for the rest of your life. My confidence in saying that you're going to maintain your weight with much more ease is much higher if you can get that long fast in. Think of that long fast as the powerful move that keeps you very insulin sensitive, that is a check to your inflammation levels, and keeps you very metabolically flexible. Truthfully, if another way to think about it is like this, you could get away with less long fasting if the other categories are more dialed in. So if you're eating really good and you're exercising really good and everything else is in play, then probably the long fasting, I don't want to say wouldn't be necessary, but you could say it would be less necessary. But that's the whole point of my program, is that I want you guys, I've created it to make it work for most individuals. And I would say that most individuals are not going to be able to maintain a life of consistently eating really good, consistently working out really good, and all the other pieces. And so think of that 48-hour fast once a month as an opportunity to essentially make up the damage for the prior month that was a deviation from perfect. That was a deviation from ideal. If you've been really dialed in, then yeah, maybe you can come up with a 48-hour fast once every 6 weeks if you're really dialed in. But I give you that wiggle room and say a 48-hour fast once every 2 to 4 weeks is what I really say is really hallmark for the lifestyle. Maria, next week I have to travel for work and won't be able to do the 48-hour fast. What is the next best practice for next week? So it's actually a good thing, I would say once a month when you're really in the protocol, to vary up your fasting. And it's nice when you let life, Maria, dictate that for you. To answer your question, what's the best thing you can do if you can't fast? If you can go keto that week, I would totally go keto. If you can't do that, what about 2 24-hour fasts? Try that. Worst case scenario, if you can't do any long fasting and you can't do keto, then just do your intermittent fasting every day. Go as low carb as you possibly can. Get some extra weightlifting, maybe get some extra cardio that week. Like, those are the different things that you can do. But obviously the keto or the separating your fasting, that's the best damage control you can do. Okay, so Carol, you're saying for me, sometimes it's easier to not eat at all than to eat something and have to control myself. You know what, Carol? I actually 100% agree with you. That's why I'm such an advocate of the fasting, because I find that most people have an easier time just not eating at all than trying to go in there and eat a small amount. I 100% agree with you, Carol, and I experience the exact same thing. Yamiri, should we be doing daily intermittent fasting and a 48-hour fast? Great question. If you can. Once you get to the stage where you are doing a 48-hour fast once a week, the most important thing, there's a lot of important pieces, but more important than doing your intermittent on the other 5 days, what's more important than that is actually getting in enough calories. So if you can get enough calories in, somebody asked about the TEE, I think that was Blair. There's a link on the Welcome To form, but honestly, you can just go to Google and type in TEE, and the very first one that pops up is my favorite one. But it's actually more important to be getting in sufficient calories on those non-fasting days. So if you can't get in, let's just say 2,000 calories is the goal. If you can't get that in 8 hours, which happens because tirzepatide is so powerful, then that's when I would say spread your meals out. Get whatever it takes to get those calories in. Maria says, sounds like a plan. Sammy, would that be the same plan if you go on vacation? I would say so, Sammy. It just depends on how, sorry, sometimes like when I get excited, it depends on how hardcore you want to be, right? Remember, I give you guys the ability to make your own decisions. And some people look at vacation as, I'm on break, it's okay if I gain weight, I'm going to come back in and get back in. If you want to look at it that way, you could do that and be okay with that. Me personally, if you are in the protocol, it's a little bit different if you're at the lifestyle. If you're in the protocol, which I know you are, you're actively trying to lose weight, I wouldn't want to backtrack. So I would make the goal of your vacation during the protocol to just maintain. If you can also get some weight loss in, fantastic. But just make the goal to not gain. And if you can't or don't want to get a 48-hour fast, how about going low carb? How about having low calorie? There's so many things you can do, right? The reason why you guys might have heard the fasting method where they do 5 days of regular eating and then 2 days of 500 calories, the FLOA protocol is light years ahead of that. But would 500 calories on 2 days as opposed to 7 days in a row of eating full be better? Absolutely, that would be better. So there's so many things you can do as a substitution. I would say spreading your fasting out would be up there on the list. Low carb would be up there on the list. Lower calories would be and kind of work your way down that list. Belinda just finished my first 48-hour fast. How does that feel, Belinda? Woot woot. Belinda just finished her first long fast. Belinda, tell me if I'm crazy, but don't you feel like you get a high from that? Don't you feel lifted? And I'll tell you what that is. That's endorphins, and that's a ton of dopamine. Fasting makes you more sensitive to dopamine. Dopamine is that motivation neurotransmitter, that brain chemical that gets you motivated on a goal, right? When you set a goal and you actually begin to execute on that goal, you ever notice how it becomes easier to execute on that goal because you're excited and you're pumped and you're like, I'm going to get this done? That's called dopamine. And you want dopamine surging. It's healthy. It's good for you to be excited to be accomplishing and succeeding on this.
And it just happens that the fasting also makes you more sensitive to dopamine too, which is awesome. Joe, do I remember you saying we can double up the AOD? Yeah, Joe, so doubling up AOD. By the way, guys, AOD is probably going to be gone in the next 4 to 6 weeks. It's freaking crazy. I mean, it's nuts. It's just, I'm looking at MOTS-C. I've been doing a tremendous amount of research on MOTS-C. We can get MOTS-C for you now, by the way. MOTS-C is pretty pricey. But yes, you can double dose AOD. And so I'm bringing that up because I have some people stocking up on AOD right now. MOTS-C does a similar effect of supporting the metabolism, but MOTS-C is really a completely different peptide. It's literally repairing the mitochondria and makes you more insulin sensitive, increases your metabolism. And the older you are, the more benefit potentially you're going to have from MOTS-C. The more inflamed and sick you are, the more obese you are, the more MOTS-C can become a bigger deal for you. So yeah, MOTS-C is great. It's just freaking really expensive. Blair, if you need more dopamine, if you need more motivation, set small targets and execute. Set a target and execute. Don't set targets that you know you're going to not execute on. If you say you're going to do something, freaking do it. And then when you do it, there's benefit from executing on it. The best way to do AOD, if you're doing one a day, is in the morning fasted, right? Hands down. And then if you're going to do a second AOD, I would do it, if you're going to do it every day, you do it in the PM before bedtime, or you can also do it a second time on your long fasting days. How effective is tirzepatide without AOD? Sandy, look, just to be clear, so I've helped tremendous amount of people, Sandy, without any tirzepatide and without AOD. Full-blown obese people with the FLOA protocol. But here's the reality of it. Without even considering a person's initial starting point, right? How sick are they? How obese are they? How insulin resistant? Without even considering that, with less aids to help, it's going to be a slower and more difficult process to get into the FLOA protocol. Can you mentally tough it out? Potentially, yes. Now, you factor in a person that is more sick, more inflamed, more insulin resistant. The difficulty level for that person to get in the FLOA protocol is going to be harder, and that's where the aids come in. Then the third variable, I hate to say it, but here's the truth. How mentally tough are you as an individual? And I don't want anybody to ever think that I'm calling them weak, because I couldn't begin to even experience how hard it is for you and your body. So I don't know that, right? I'm not in your body. But the truth of the matter is, there is a certain amount of mental toughness that can make up for what these medications do. That's why I call them aids. That's why I call them tools. And I think for most people, they're actually necessary. But let's not get it twisted here. It's the protocol that's accomplishing the long-term aspect of this. MOTS-C is more expensive than AOD, yes. So here's the MOTS-C. You have to take AOD on an empty stomach. Yes, you want to be empty on AOD. I can't tell if AOD is doing anything or not. So Carol, AOD is not like tirzepatide where you feel the appetite suppression. AOD is like BPC, CJC. Like, you're not going to have this profound change where you notice something immediately, but you do have to trust in the process of what it's doing. But yeah, AOD, some people feel AOD. It's crazy. I'd say probably 1/3 of people can tell, like, their energy goes up. I mean, look at Amber. Amber's not on today's training, but she's been doing my program for about 6 weeks. And the first week she took AOD, she said her weight loss doubled. So it's all across the board what happens. It's not necessarily supposed to cause more weight loss. It's supposed to cause a higher percentage of fat loss that you would have otherwise not have had. That's really what AOD does. And it helps improve metabolic flexibility. Maria, I know this is a basic question, but I am still not sure. No, there's no basic questions here, Maria. You guys are all part of my private groups. You guys ask away. I know this is a basic question, but I'm still not sure. What my daily calorie intake should be for the fasting days. I'm still not fasting. So Maria, go calculate your TEE, right? And you should be striving to eat about 15 to 20%, at least 20% less than what your TEE. So if your TEE comes out to be 2,000, then you should be shooting for 1,800. Those TEE calculators are consistently accurate when you apply my ratio to it, because they're always a little bit too high. I need something to reverse menopause. Carol, so If you're, I think what you're talking about, let me know. Night sweats and hot flashes are brutal, and I can't obviously sympathize, but I can empathize because we've been helping women for the last 10 years with hormonal therapy. Carol, I don't know if you knew this, but I actually work with women's health practitioners, and so that's one of the things that we specialize is bioidentical hormone replacement therapy. So if you want something to just crush your night sweats and hot flashes, we got to get some estrogen and some progesterone in your body. And we do the injections, oral troches, creams, things like that, which would really help your weight loss too. Wouldn't be necessary for your weight loss, but if you are talking about specific menopausal symptoms like that, then BHRT is the way to go. AOD is a fat mobilizing agent. It's a fragment of the human growth hormone. And what AOD does is it helps mobilize body fat, which in conjunction with your caloric deficit, which is what you're going to get from the fasting and everything else, it makes for a very powerful combination. Are you supposed to cycle off and on AOD? There is no literature. There's very little human literature when it comes to cycling on and off peptides. But I always recommend cycling on as a safety precaution. When it comes to AOD, if you're doing it every day, I would say about 4 months, 3 to 4 months, take a month off would be a good approach. Don says BHRT is a game changer. It really is. I remember when my mom hit menopause and I got her on BHRT. That's what really honestly got me into the women's side was my mother. She was dying. For me, obviously myself, getting on testosterone for the man side, but getting my mom, that's like 8 years ago, and that's when we started doing it for women. Right now, I would say the closest thing to try to get like what AOD does from supplements would be the Unimate tea and some exogenous ketones. That would probably be the most powerful supplement that can give you something in like the same category of that metabolic flexibility. Or MCT oil would be the third thing. Carol, what's cool about AOD is there's really no one way to do it. Literally, I'll give you guys multiple different ways you can do it. From the lowest budget to the maximum. Like if someone told me I'm broke, what's the most cost-effective way to take AOD? I would say only on your fasting days, right? The next level up would be taking one every day. The next level up would be one every day plus 2 on your fasting days. The next level up would be 2 every single day. But you could also throw in splitting it as well, right? So AOD just has that effect where you really can almost create any program for yourself based off of budget, and generally the more you get, the better the effect. There really isn't a minimum per se. I mean, I wouldn't do less than half a troche though. I've never seen someone take less than half, so I couldn't tell you if maybe there is a minimum that you need to take. But I have less experience with people taking half of a troche though, Carol, so I would stick with full troches each time. So if you guys are wondering what the symptoms look like for BHRT needs, so let's talk about testosterone, for example. Here are the symptoms, man or woman, of low testosterone. So ask yourself, do you have half or more of these symptoms? Some of them cross over with weight loss, so we'll talk about those first. Lower energy, brain fog, right? But then here's where it gets unique to testosterone. Increased anxiety, increased depression, lower motivation, lower sex drive, lower confidence, lower just vigor for life. Your response to weight training and workouts are starting to deplete. And then obviously men, if it gets really low, can have erectile dysfunction. But even before erectile dysfunction for men, they're getting a lot of these same symptoms as well. So women benefit from testosterone just as much as men do. They just are taking a much lower dose. And then women also have the menopausal symptoms, which is more of an estrogen and progesterone thing, which is basically night sweats and hot flashes. So what we're going to do is we're going to do a recap here on the importance of sleep, and then we're going to talk about how the FLOA protocol affects it. So lack of quality sleep is an example of a stressor, just like chronic stress. And what both of these things can do in terms of weight loss is cause spikes of cortisol, and high levels of cortisol cause higher levels of blood glucose, which obviously interferes with the ability to become more insulin sensitive and prevents weight loss, right? Or at least greatly inhibits it. And so if sleep is the issue, and what we're shooting for with quality sleep is 7 hours of quality sleep, okay? Anything less than that is a deviation from ideal. And so from a general perspective, before we even talk about flow-induced sleep issues, if you're not already getting, that's an issue. And that's why sleep optimization has always been one of my pillars of optimal health and of lasting weight loss. And so if you're not getting quality sleep, then you definitely need to implement the strategies on that video in FLOA University sleep optimization, as well as the sleep supplements that we recommend on the welcome to form. Now, if you notice sleep was fine, and then all of a sudden you start doing the FLOA protocol fasting, and you started noticing that your sleep started decreasing, your quality, maybe you're waking up earlier, a little bit harder to fall asleep, a little bit more restless, you have to understand that is potential side effect of the FLOA protocol. The reason why it's happening is because this aggressive nature of fasting, one of the many good things that it does is it does increase levels of catecholamines or fight or flight hormones, right? So epinephrine, norepinephrine, noradrenaline. These are like alert sympathetic responders which help mobilize body fat, they protect muscle mass, they make you feel good, but they also can interfere with quality of sleep. And so if that happens to you, now you know why, right? And you need to fix that as quickly as possible. Because this is really important to understand. The benefit of increasing your fasting does not outweigh loss in sleep. So if you are experiencing a disruption in your sleep, and it's not just 1 week, it's not just a couple days, but it's going on, you need to text us on the FLOA hotline so we can help you. But watching this video is going to give you the initial understanding. You need to back off your fasting. You need to get on those sleep supplements. You need to implement those strategies. You need to fix your sleep as fast as you can. And then when you start fasting again, you start to increase your fasting windows slower. All that means is that your body is more sensitive to the catecholamines. And that's okay. Your body does become more accustomed to them, and your body will eventually get through that reaction and start to get nice quality restorative sleep. You just need to back off. You just need to slow down and then restabilize and then titrate up. It's the same concept of somebody who's experiencing very low blood sugar from fasting. You back up, you restabilize, and you titrate back up slowly within a safe, comfortable range. We have to have quality sleep. That's crucial. So that's it. It's really that simple to addressing FLOA protocol-induced sleep issues.
If you guys found that informative and helpful regarding tips and tricks for lasting weight loss, then you're gonna wanna watch this next video where I break down even more strategies and the things that I find most effective for my private paying group. I hope you guys enjoy.